We're examining the current COVID-19 spike and what it means for a state anxiously awaiting an end to this pandemic. That's this week on Nevada Week.
Support for Nevada Week is provided by Senator William H. Hernstat and additional supporting sponsors.
Across the board, every major COVID-19 indicator is on the rise, and experts say this current surge has yet to reach its peak. Governor Sisolak has called the current situation, quote, dangerous, and our state has responded with a 3-week statewide pause. There is one bright spot. Vaccines are on the way, but leaders are calling for extreme caution during a very critical period of transition before vaccines are widely distributed. Without a reverse in our current trends, some public health experts are forecasting a, quote, dark winter when our death toll could double in a matter of months. To help us examine our current spike, please welcome back Dr. Brian Labus, assistant professor at UNLV's School of Public Health and a member of Nevada's statewide COVID task force. Dr. Shadaba Assad, infectious disease specialist at the University Medical Center, and Dr. Joe Corcoran, Chief Medical Officer for HCA Healthcare, Far West Division. So much to cover, so let's jump right into it. And I think the biggest news right now is the day before our recording here, Governor Sisolak has announced that a vaccine will be here potentially in a matter of weeks, but wide distribution is not going to occur until the spring. Dr. Assad, I wanted to ask you, does this mean that we just stay as vigilant as we possibly can until we get to the spring, and once we get wide distribution, it's clear sailing, and that'll be the time we'll be relaxing a lot of our restrictions here?
Okay. You know, I clearly see how the public, it's been so many months into the pandemic, so some degree of frustration and fatigue is completely understandable. But I think the message that needs to be put out there is that we're almost at the end of this battle. And while we are waiting for that vaccine, and I honestly hope it's not spring we're talking about, but at least start vaccinating before the end of this year and then make our way through different tiers of the population. But till that vaccine gets to you, we still need to be excellent about our non-pharmaceutical mitigation measures, which are things as simple as wearing your masks, maintaining your distance, practicing good respiratory etiquette, avoiding gatherings where people are in close quarters with poor ventilation for prolonged periods of time. It's frustrating, it's difficult, it's not life the way we knew it, but it's not for too long. As to your second question, is it going to be smooth sailing after the vaccine? Couple of things. First of all, based on the preliminary data that's been released by Pfizer, BioNTech, as well as Moderna, the vaccine does appear to be very effective across all age groups, genders, ethnicity, demographics. It actually is very effective, even more so at preventing severe COVID infection. So you could get COVID after a vaccine, but at least in the trial amongst the people who received the vaccine, there were no cases of severe COVID infection. It's also very effective amongst people who are elderly. But the fact of the matter is, this was a trial setup. As of now, we do not know how this vaccine will behave in real life conditions. So that's one reason why it's not just give up all of these non-pharmaceutical measures the moment you get your vaccine. The other thing is that smooth sailing period starts once everybody in your community has been vaccinated. And that is probably, realistically speaking, going to happen somewhere towards mid or late 2021. So it's only when almost the majority of your population is vaccinated and immune to the disease that we can say we're in a much more safer situation. So for the foreseeable future, even if you've been vaccinated, you will have to follow those things like wearing your mask, maintaining your distance, being careful about the groups and locations that you gather in.
Brian, I wanted to go to you here. Of course, this is probably not something that our public wants to hear right now, dealing with how much fatigue we have of restrictions really going on a year by the time we might see wide distribution. You're on the task force. You're giving recommendations to the governor. Is this baked into our plan here? Is this where we are going to see a lot of the restrictions maybe now, maybe a little bit lessening and when we have more wide distribution, but yet we are still going to be in some form of a restricted, mandated plan until everybody is vaccinated?
Well, the plan has to do with how much disease transmission is occurring in the community. And so you can really separate it from the vaccination piece and say we have to look at what's going on. If we're still seeing a lot of transmission as we're getting people vaccinated, we'll have to maintain all of those social distancing things. The vaccination program is going to reduce that transmission. So even though it doesn't have particular things about when we reach a certain percentage of people vaccinated, we look at what that actually does in the population. So if people are vaccinated, we won't see the same transmission, and we'll be able to back off on some of those things. But like Dr. Assad said, it's going to take a while to get to that point. We're talking about rolling out a vaccination program to the entire community. We have a vaccine that has potentially multiple doses, and that can take weeks from your first shot until you're actually protected then, so that's part of it. And we really have to think of this as not the end, but really the beginning of the end. We're moving into that last phase, but it's going to take some time until we're back to normal. It's not like that can happen overnight, unfortunately.
Now let's talk specifically about the spike that we are experiencing right now. Of course, very concerning across the board. We're seeing increases. Dr. Corcoran, I wanted to go to you first. Of course, one of the biggest concerns is our increases in hospitalizations that we are seeing here. It was just reported yesterday, the day before our recording here, 100,000 hospitalizations across the nation, the first time we've reached that benchmark. Can you give us some insight here locally within the HCA system? How concerning is this, and exactly what are you seeing as far as hospitalizations?
So we've really had 3 waves to date. When we first had our first cases in March, it was kind of a low, then a medium in July and August, and now the biggest wave of all. So we are across the valley at our 3 hospitals, Sunrise, Mountain View, and Southern Hills. We have 347 positive inpatients in the hospital today. And that puts us overall about 20-25% higher than what we thought was the peak back in July and August. And that wave was about 40% higher than what we experienced in March and April. So the waves keep building up, and I absolutely agree with the other guests that, you know, there is a light at the end of the tunnel this time, thank goodness. So we are beyond our previous highs at 2 of our 3 facilities, and whisker close to going 3 for 3. We still have amazing people doing amazing work at the bedside, and I can't say enough about their commitment. And you know, you were talking before the show about everyone's tired, and I think those at the front line probably are nearing exhaustion. So, you know, I want to echo Dr. Assad and Brian's sentiments that, you know, we may be rounding third on this pandemic. There is a vaccine available. There are antibodies available. But this is not the time to lighten up on our own behaviors that reduce our own risk. I think the greatest thing that we can do for our frontline workers is stay healthy. We still have ICU capacity. We still have ventilator capacity because by and large, I think we're seeing the infection in a younger crowd. We have gotten smarter about how we treat these patients so that we are avoiding putting tubes down their throat for their breathing. We're looking at high flow nasal cannula. We're looking at non-invasive ways of managing these patients. So we've really shifted a lot of the hospital burden from the ICU to the med-surg floors. But, you know, we will be there for our community. That's our commitment as an organization. But again, don't lower your guard. Don't become one of our patients if you can avoid it at all.
Dr. Assad, let's talk about that tipping point here. Dr. Corcoran, of course, it sounds like the learning curve here has been extremely steep. New methods of treatment that has reduced the amount of deaths that we are seeing versus what our hospitalization rate was, at least early on. but there has to be a tipping point here, Dr. Assad. And are you concerned at all if we continue to see the rate of the increase that we are right now in our current spike, that we could get to a stage here, particularly in Southern Nevada, where our hospitals can be overburdened?
I actually have absolutely no doubt that if we continue on this trajectory and the public really doesn't pay attention, there will come a time when our hospital and healthcare systems will become overwhelmed. It's true that since the beginning of the pandemic, we've learned a lot more. Our strategies to take care of these patients have improved, but there is a limit to the capacity of any healthcare system, and we are getting dangerously close to exceeding that. And the only thing that can actually help in this situation is that the public understands that we get that they're tired, fatigued, and frustrated. But you don't want to be in a situation where you are sick and there's no place in a hospital to admit you. I have no doubt that if we continue on this trajectory, it will strain our healthcare system.
Brian, I want to go to you. A lot of the talk here, we're talking about fatigue, we're talking about understanding, we're talking about public perception, intangibles maybe when we're asking about why we're seeing this spike that we're seeing right now. It's not youth population or a specific super spreader. It seems to be more generally just public perception, understanding of this disease. Are you seeing that as maybe one of the critical factors of why we're seeing the spike we're seeing right now?
Well, I think any spike that we see is a direct reflection of the behavior of the population. If we see a lot of disease transmission, that's because people are getting together, spending time in close contact. And we had Thanksgiving last week. That brought a lot of people together. It was the busiest travel days we've seen since March nationwide. So all those human behavior things come together, and that's what allows disease to occur. And I think this far into the pandemic, people really are sick of it. I don't like wearing a mask all the time. I don't like staying home, but those are the things that we have to do. And people kind of let their guard down a bit, and that allows for transmission to occur. So I think that's the biggest problem. We're talking about just the reflection of our behaviors, and coming into December, it's quite concerning because we just had Thanksgiving, we have Christmas and New Year's at the end of the month, and those are all opportunities for people to get together and really drive this pandemic. And that's the opposite of what we want to happen. But it's very difficult to get people to have a different Christmas this year or even think about those sort of things. So it's quite a challenge to change behavior, especially when it's not the beginning of the outbreak. It's a year into it, and people are quite tired of it at this point.
Now, our state has issued a 3-week pause. Some of those restrictions you're mentioning right now, public gatherings reduced to 50 people, private gatherings down to 10. And then gaming, restaurants, bars, performance venues from 50% capacity to 25% capacity. Are we seeing these restrictions based on exactly what you're talking about, that because this is more of a behavioral thing, we're just trying to reduce the amount of gatherings we possibly can during this interim?
That's the idea behind all of these restrictions. It's simply trying to keep people from gathering, whether it's in their homes or in a public space, because that's when transmission occurs. So if we can reduce that, if we cut the number of gatherings in half or the density of those gatherings in half, we can potentially cut transmission in half. So it may seem like it's just a minor thing to stay home, and it won't really make a big difference in the pandemic, but really, no individual snowflake thinks they're responsible for the avalanche. And that's the problem we have right here of everybody does a little bit, and it all kind of comes together and reduces transmission and really can go a long way to keeping disease from occurring until we get to the point where people are vaccinated.
Dr. Assad, another major variable here, of course, in addition to just restricting people being close together, is knowing who is tested positive, who is infectious, and who is not. Of course, there's been a lot of criticism around not having robust enough testing to be able to do that. But a lot of the research that's coming out that I'm reading is saying that a lot of the spread is happening from those asymptomatic spreaders, those that aren't showing any symptoms. Is that what you're seeing here locally?
So it's impossible. There's no doubt that people who are asymptomatic or pre-symptomatic can certainly have a sufficient viral load and they can spread the disease. I don't think it has to do with just us not being able to detect people who are asymptomatic or pre-symptomatic. I think it has to do with very simple behavioral patterns that lead to this increased spike of the disease. It's challenging, right? Because in the previous SARS epidemic, people the moment they became symptomatic, that's where their infectivity would start. So it would be very easy to identify those people and isolate them. One big problem with this particular SARS coronavirus 2 and this COVID-19 infection is, yes, there is almost a 48-hour period before people are completely asymptomatic, and then there's a large number of people who will never be symptomatic, and yet both of these populations do have a significant viral load, and they do have the ability to spread the infection. But I don't think testing alone is the problem over here. We will never have a perfect situation where we can have enough tests to identify everybody, including asymptomatic and pre-symptomatic people. We will simply have to accept that as long as this pandemic is going on, we will have to modify our behaviors to prevent the spread of this disease.
A lot of talk then, Brian, around contact tracing too, and still this is a behavioral thing, and of course contact tracing will lead to behavioral shifts. Let's talk more about contact tracing though. We've been several months now. I know most of it was implemented June, July. We've been expanding that since then. Our state has invested $30 million into our contact tracing. Back to where our spikes are we learning anything through the investigation of our contact tracing that's leading us to be able to hone in, localize any hot spots at all?
Well, I don't think there's any one individual hotspot in the community. The data we've seen kind of reflects what we've seen nationwide, the types of gatherings that are more likely to lead to transmission. We know that if you get a lot of people together in your household from multiple different households, there's a good probability of transmission there because you're together with your family and friends, you're taking your mask off, you're spending a lot of time in close contact. The other thing that we've seen locally and nationwide is bars and restaurants. And it's just the perfect environment for the spread of disease because you have a bunch of people sitting closely around a table and taking their masks off to eat. So those sort of things that we're seeing locally are kind of the same that we're seeing nationwide. It's those gatherings of people from multiple households where we see the transmission really occurring. Beyond that, when we look at the usefulness of contact tracing, as we see these big spikes, contact tracing becomes less useful on the spike when it's increasing. When we get on the other side and things are decreasing, it has more and more value as you start to track down all those cases and stop the transmissions. But if there's so many that we can't even get to them, then contact tracing can only go so far to interrupt disease transmission.
Let's talk about that. We talked about the tipping point here at our hospitals here. Are we nearing some form of tipping point where contact tracing is no longer useful to us?
I think contact tracing is always going to be useful. Even if you only reduce 10% of the disease transmission in the community, that can make a huge difference. And so if we're overwhelmed and we're not getting to everybody quickly, that's obviously going to pose problems. But so far in this surge, we've been able to keep up with the number of cases that are coming in. I think the difference between this surge and the previous ones that we've seen is really the rate of increase. The first one that we saw, it was this spike that took off rather quickly. It was a little blunted in the summer, and now it's been more of a gradual increase. So that is going to increase hospitalizations and cases and deaths, but it does it at a bit of a slower pace where we can keep up with it a little more. And so contact tracing, no matter what's going on in the community, has some value. It's just that value changes over time to be a little less useful when we're having rapid spread in the community and much more useful as we get things under control.
Yeah, that value changes, and that's incorporated so much into how our state, of course, is leading to these mandated restrictions here. There's just this balance, this intersection of public health and science and politics and economics, and that's such a delicate balance. And Dr. Corcoran, I wanted to go to you. When you're looking at our current state restrictions, do you agree with our current balance? Do you agree at where we are going with our restrictions? Are they stringent enough?
So I think the answer is yes. I know that Brian advises the governor, and I think that the governor has been getting good information and good advice. You know, I worry about the long-term implications of the social isolation that this country and really the world has drifted into over the course of the last year. As a scientist, I completely understand the rationale behind it and the value behind it. But I wonder about what the long-term implications are going to be. I have 2 school-age kids, and just seeing the difference in their approach and how they interact with their friends is very different than our experiences were in high school, right? So what are the long-term implications? What are the long-term implications of delaying treatment for some pretty serious problems. Across the country, there has been a 17% drop in patients showing for appointments for chemotherapy. I understand that they are immune compromised and worried about whether they will die of COVID versus cancer. So they're making informed decisions, but that concerns me. That's why our biggest emphasis has to be keeping our frontline workers safe, keeping them healthy, keeping our hospitals clean and safe places to seek treatment, because we can't keep putting off treatment for a problem. As an obstetrician gynecologist, I always preach that we want to deal with little problems before they become big problems. And I do think that, to Brian's point, the more we do have folks experiencing going into public gatherings, family gatherings, and trying to reconnect and walking away from it without any consequences, it normalizes the behavior. I think we're getting a lot of pushback about mandated shutdowns, and maybe we are messaging it ineffectively. Maybe what we should be doing, instead of telling you can't go out in LA County any longer, according to Mayor Garcetti, maybe what we should be doing is reminding them of the risk that going out in big groups, not wearing masks, carries. Keep pounding that message, giving them the reason why rather than simply mandating. And that's why the governor's last rounds of advisories have been about do the right thing so that we don't have to go to the extremes that they're talking about now in California.
Dr. Assad, this brings up an interesting point, too, of just kind of managing where we are and that being potentially part of the message here. And I wanted to bring back to the capacity question. When we're talking about distribution and administration of a vaccine on the scale that we are going to see in a couple months, if you couple that with an increased rise in cases that we're seeing in hospitalizations, those two things, do they overlap at all? I mean, we could have a situation where our healthcare system is not prepared at the level it should be to administer a vaccine because we are still managing the virus itself.
I think that is definitely a concern. But for example, I can speak for you as well as, the representatives of the other hospitals throughout the city that I've talked to during different meetings. We've started planning for administration and distribution of this vaccine for several weeks now. So we knew that we would be very busy at this point. So this is not something that we're going to start planning the day we know that the vaccine has received an emergency use authorization. This is a process and planning that has been going on now for several weeks. And I know we've had several meetings with the local Department of Health, with different hospital representatives, and that there are plans in place. We are ready the moment we have the vaccine to start distributing it.
We have a few minutes left. Brian, I want to go to you. Let's bring this back to what is most critical right now over these next couple of months. Of course, we've been talking a lot about just behavioral shifts here, making sure that we're staying as vigilant as we can to those main restrictions that Dr. Assad listed at the beginning of our show. Beyond those, what should be top of mind right now as we look into what a lot are calling this dark winter here, several months of where we're going to continue to see potential spikes and the risk of contracting the disease could potentially be so high? What do we need to keep in mind?
Well, over this entire outbreak, it's been tough to get people to do things because we can't say what the endpoint is. But now with the vaccine, we actually have a potential endpoint on the horizon. We can say when we vaccinated 70% of our population, we can basically go back to normal. And so that's on the horizon. And I think what we have to think about now is how do we get to that point safely? How do we get there without having more deaths and more cases? And if we can say, listen, it's going to be a few months of this, but not the rest of your life. Stay home, wear your mask, do those things we've been saying all along. But now there's that endpoint that we can look at and say, this is coming down the road. And we can also think about getting people ready for that vaccine. Right now, we don't have that much information on it. The information we've gotten has been from company press releases and things like that, but it's going to go to the FDA for approval. So we get to hear all the information about side effects and adverse events and all those kind of things that we're concerned about. And so we can start to get people ready for that vaccine. There'll be a lot of discussion about what the order is of people getting vaccinated. But I think with that endpoint on the horizon, we can actually point to that and say, let's just keep doing these things for this relatively short amount of time until we're actually protected and finally past this outbreak.
It's a great point that the finish line is near, to use maybe that euphemism. And Dr. Corcoran, we got about a minute left. What do you think needs to be top of mind here for our public?
Don't give it up yet, right? We are so close to getting through this together. And now is not the time to lower your guard. We still have to be very, very focused on protecting our most vulnerable, even if it's older family members when we get together. The great part about being in Southern Nevada is we have access to the out of doors. And Dr. Assad, Brian I'm sure will agree that it's safer outdoors than it is indoors. If you are going to get together, maybe you move the Christmas dinner to the backyard instead of the less well-ventilated living room. So making smart choices now is more valuable than maybe ever in this challenge.
Great point. We do have the climate to be able to do so many of our activities outdoors. A great way to end the show. Dr. Corcoran, Dr. Assad, Brian, thanks so much for joining us again. We really appreciate it. Well, thank you as always for joining us this week on Nevada Week. Now, for any of the resources discussed on the show, please visit our website at vegaspbs.org/Nevada-week. You can also find us on social media at Nevada Week. Thanks again.